Okay, all. Dr. Gamaro here. I just wanted to introduce you to the fetal pig, at least for the blood vessels that we're going to be dissecting out. First thing I want you to do is probably this is the best thing to do. You'll find pictures inside the folder that you're going to have all for this lab assignment. Um, One of the pictures are these wonderful diagrams. If you want to print these out, this is my suggestion. If you want to print them out, there's three of them. There's one for arteries for the upper arteries found above the diaphragm. Okay, so this is arteries found above the diaphragm. Then you'll find veins found above the diaphragm. And for next week, but if you want to print out at the same time, this is going to be all blood vessels, arteries, and veins below the diaphragm. Now, this is pretty much everything in the abdomen and the leg itself, both legs, that you're going to need to know, with the exception of the hepatic portal system, which we'll discuss it when we get into next week. But at least you should have those printed out for you when you want to start dissecting the pig. Would say get them laminated, but that's way and above call because you'll probably get a lot of. You can always print it again, but you'll probably get a lot of pig juice on it as you do the dissections and pointing to things and things like that. So, okay. So I just wanted to give you a heads up. There are a couple differences in blood vessels between the human and the pig. Minor, but they are differences. And if you're familiar with the human, you're going to be a little bit sidetracked of figuring out, well, where is this in the pig? So I just wanted to point out what those two differences are. Both of them relate to the to arteries, not veins. Okay. So first off, in the above the diaphragm, there's something that's different, and where the legs are, there's something different. So let's just talk about very briefly the how the human heart is. So just as a quick review, okay. So this is the human heart, okay, and from the left ventricle, you're going to have the aorta, okay. Now in the human, we have three branches coming off of the aortic arch, okay. Well, let me just show you like this. Okay. Remember, this is going to be in this area right here. This is going to be the ascending aorta, and then you're going to have this aortic arch, and then you're going to have the descending aorta. Okay. And the descending aorta, this is going to be found above the diaphragm. Then this portion here is going to be the descending aorta, of course, okay? But it's also going to be referred to as a thoracic aorta. And again, I'm just abbreviating to speed up time, okay? And so it doesn't look too messy, okay? But on your exams, you would write down the full words. And then once it passes the diaphragm, until it eventually will split into two things over here. Then this is going to be called, still the descending aorta, but because it's below the diaphragm, we now refer to this as the abdominal aorta. Okay? So, just a quick review, but I'm going to erase this now because I'm going to eventually draw something behind here. Actually, we'll just leave it here and I'll erase it in a moment. All right, so what I want to do is just spend time talking about this because that's what's different in the pig, okay? In the human, and this is human now, all right? I'm going to say this is the human area. We're going to see that there's three branches coming off the aortic arch. The first branch over here is what? The brachiocephalic trunk or some people say the brachiocephalic artery. Okay, again, I'm going to just abbreviate. These are arteries. The second branch over here is going to be what? This is going to be the left common carotid artery. And then the third branch over here is going to be the left subclavian artery. So if the left subclavian artery and the left common carotid artery are here, then where is, and there has to be if there's a left, there's going to be a right, right? So where is the right common carotid? Right, the brachiocephalic is a very short stem, and it's going to branch into two things. So this is going to go up to the head on the right side, so this is going to be our right common carotid, and then we're going to have this branch over here, which is going to be our right subclavian artery. Okay? So that's what's happening with, sorry, get up frame, but that's what's happening in a human, at least blood vessels coming off the aortic arch. Now, I want to show you what's happening in the pig because that's going to be a little bit different. Okay. What we have here, and I'm just going to draw the part where we're going to see the difference here, all right? Just so it's not so messy, I'm just going to erase this. You know what this is over here. Okay? Again, now I'm going to do the pig. All right? We're going to have the same aorta, the aortic arch. Okay? Again, this is going to be the pig. Little pig. All right. So on here, this is what makes it a little bit different. We're still going to, and I'm going to erase this. I just want the blue to stand up there. We have the ascending aorta, the aortic arch, the descending aorta. It's all the same. But the aortic arch doesn't have three branches coming off in the pig. Instead, there's only two. This is still going to be going off into the arm, so this is going to be our left subclavian artery. This is still going to be our brachiocephalic artery. But off the brachiocephalic, we're not going to have just two branches coming off, but you're going to have three. So it kind of looks like this. You could guess what those are going to be, right? This is going to be our left common carotid artery. This is going to be our right common carotid artery. And then this is going to be our right subclavian artery. Okay? So it's a little bit different, and I'll be honest with you, this is what 70% of people have in our bodies, but there is 30% is what we refer to as people having anomalies. Anomalies are, the anatomy is different, but the physiology remains the same. It does not affect the physiology. So we have, I wouldn't say 30%, but there could be part of that 30% where this is how the blood vessels are arranged in a human. Blood still gets to the right places. Why it happens, we're not too sure. But this is important when you get into your medical fields and knowing about anomalies, because if you have to do, let's say, a catheterization and being able to put a catheter into someone's heart, if you know that that person has blood vessels that are not what 70% or majority of people have, then you know where to actually go. And they could do what we could shoot a dye, and we could actually see what the vasculature of that patient is before we go ahead and do the catheterization. Okay, so just want to let you know again. This is the human up here in most humans. So we will use what most humans are. This is what I expect you to know for our exams. Except when we deal with the pig, I want you to know it like this. Okay? All right. So that's pretty much the major difference, at least above the diaphragm, in terms of blood vessels. And it only affects this one area that you need to know. All right? Now, I want to now explain to you the differences down below.